Hello, and welcome to this video on the benefits of on-site primary care clinics for your business. My name is Chris Oldenburg. I'm the Marketing Vice President for Catastrophic Medical Excess. Let's get started. Primary care worksite clinics are not new. In the past, however, they were exclusively for larger companies. But because of the growing trend, they may now be the answer to the soaring costs of employee and dependent health care and wellness. Having a doctor or a nurse practitioner on site can lower costs and make employees healthier and more productive. As you can see in this slide from a 2006 Mercer study, 25% of your costs are easy to see and point to medical and pharmacy costs, while the larger portion of 75% is much harder to see productivity costs, such as absenteeism and the new term presenteeism, which is basically where employees are at work but they don't feel well and therefore less productive. Would it surprise you to know that 20% of your employees are either pre or full-blown diabetic and didn't know it? This quote is from Dr. Rebecca Kelly, who's the Director of Health Promotion and Wellness for the University of Alabama, and it talks about predicting catastrophic claims. In a recent study of an on-site clinic, we found that 21% of those employees haven't seen a doctor in 10 years. 50% haven't seen a doctor in 2.5 years. You may be saying, that sounds great, but where do the savings come from? Let's look into that. Two ways of savings occur for the business. The first wave involves getting people out of the retail healthcare market, and the second wave involves wellness and disease management that the clinic does once issues have been found on a health risk assessment. The following slide is an actual healthcare trend report done by a county commission which uses an on-site clinic model. As you can see with this slide, the commission has realized a savings of $4 million over 3.5 years of using the clinic. When the clinic went operational in 2008, costs were $6.5 million. The first year of the clinic, costs went up slightly due to usage, but from that point on, the cost curve has leveled off, while Blue Cross Blue Shield projected costs have risen along with normal trend. In 2012, their healthcare spend was $8.2 million, which is 1.8 below trend. If you take that and continue to predict it out, you can see how savings increase. What if I told you that you could recruit and retain quality employees with an on-site clinic? With the looming primary care doctor shortage, having an on-site clinic can be the differentiator between you and your competition for employees. Here are some articles on the doctor shortage, but there's even more evidence out there. Why don't you Google primary care doctor shortage and see what you can come up with? So what does all this mean to you? Your company can put in a clinic which can save your employees and their families' lives, save your company money, and differentiate you from your competition when it comes to hiring quality staff. I'd be happy to talk to you to see if your company would qualify for a clinic. I have listed my phone number and my email address here. Thank you for your time. Have a great day.